Hi, I'm Dr. Sukhpreet. I'm a dermatologist. So today's topic is PRP. PRP is platelet-rich plasma, which uses healing power of your own blood to enhance your skin and to rejuvenate your skin. In the procedure of PRP, a blood sample is withdrawn, which is kept in a centrifuging machine so that the plasma and the rest of the blood components get separated, and we use that plasma for the rejuvenation of skin and collagen synthesis. The PRP is started. The first step will be cleansing and skin preparation. In this step, we ensure that all impurities are removed from the face so that the skin is ready for the treatment. The second and the most important step is blood withdrawal. Under all safety precautions, blood is withdrawn from the patient. A small amount of blood is withdrawn, which is used for the process, and all this causes minimal discomfort to the patient. The third step is plasma separation, in which the blood which is withdrawn from the patient is kept in a centrifuging machine so that the rest of the blood is separated from the plasma. Till the time centrifugation is done, we will apply numbing cream to the patient for approximately 30 to 40 minutes so that patient will not experience any pain during the procedure. The last and the most crucial step is injecting plasma into the targeted areas of the skin, which will stimulate the collagen synthesis in the skin. There are a lot of benefits of PRP. It enhances collagen and elastin synthesis in the skin. It also reduces acne, scars, pigmentation, as well as fine lines. So it overall benefits your skin. As compared to the other procedures available in the market like Botox and fillers, PRP is much safer because it uses your own blood for the treatment. And it's minimally invasive technique. It works up to the deeper layer of the skin. Like any other treatment available in the market, there are minimal side effects can be seen with PRP like redness, itching, which is transient, not permanent, and can be resolved within the 24 hours after the treatment. And what is the aftercare that is important after PRP? So we need to keep ourselves hydrated, not to use any active agent on the face for the next 24 hours. Apply good amount of sunscreen, a broad spectrum sunscreen after PRP. That is all needed post care. So in case you have a history of cold sores, herpes simplex, so you need to consult your dermatologist before starting this treatment. The ideal patients for PRP are patients who are having fine lines, patients who are suffering from acne scars, and patients who are having sagging of the skin. These patients are the ideal candidates for PRP. Any treatment that you take needs commitment and patience. So PRP results are usually seen within 3 to 6 months post-treatment. So in short, you should choose PRP. It's worth the hype. It can stimulate your collagen synthesis. It can make your skin look brighter and fresh.